how long you've had diabetes plays a big role, all right? So for someone who has had diabetes for 1 year, compared to someone who has had diabetes for 10 years and 15 years, the risks will be different.
Well, that's in a way true and in a way not true. If you're looking at type 2 diabetes, it's purely a lifestyle disease that we talk about. Especially if you consume foods that are converted mainly to sugars.
Imagine slowly losing your sight, not suddenly, but bit by bit. The faces of loved ones becoming unclear, reading becoming a struggle, and the beauty of the world slowly fading into shadows. This is the painful reality for many Kenyans living with diabetes, a disease often thought of just as high blood sugar, but one with far-reaching consequences, including damage to the eyes. Diabetes is one of the leading causes of blindness in Kenya today. It silently gives rise to diabetic retinopathy, a condition that damages the tiny blood vessels in the back of the eye. And that's not all. People living with diabetes are also at a much higher risk of developing glaucoma, famously called the silent thief of sight, because it creeps in without warning until it's too late. In this special episode, we revisit these critical conditions, understanding how diabetes, diabetic retinopathy, and glaucoma are deeply connected. We hear from doctors and how early detection, proper management, and lifestyle changes can save sight and save lives. Because blindness from these conditions is not inevitable, it is preventable.
My name is Dr. Daniel Katambo, a consultant physician and a local practitioner. I am the director of AfyaCode, which is a health tech company which deals with lifestyle diseases. So diabetes is a group of diseases actually that results in elevated, if your sugar is supposed to be around 4 to 7, then the sugar is usually around above where it's supposed to be. And anything that is above, usually we call it diabetes.
I'm Dr. Rebecca Randasaba, a consultant ophthalmologist with a subspecialty in a group of eye diseases that we call glaucoma. So diabetes has an effect on the eyes and causes different categories of eye problems. So we have one that we call cataracts. We have what we call diabetic retinopathy, and we also have glaucoma.
When blood sugar is uncontrolled over years, it weakens the tiny blood vessels in the eyes, causing them to leak or block, leading to vision problems.
What happens is that blood sugar rises in the bloodstream, and the higher it is, it now starts causing complications in the eye, all right? So at the back of the eye, we have what we call the retina, which is a layer of nerves that transmit information from the eye to the brain and helps us to see, and also has blood vessels. These blood vessels now supply oxygen and nutrients to that layer of nerves in the back of the eye, basically the retina. So when you have diabetes and your sugars are not well controlled, the high blood sugars end up slowly affecting the blood vessels. They swell and they become weak and they become leaky and start bleeding inside the eye.
Many people believe that eating too much sugar directly causes diabetes. Is that really the case?
Well, that's in a way true and in a way not true. If you're looking at type 2 diabetes, it's purely a lifestyle disease that we talk about. Especially if you consume foods that are converted mainly to sugars, and especially those ones that we call ultra-processed foods. Things like biscuits, things like chocolates, things like sweets, things like pizzas, they tend to be converted to sugar. Now when you take such an amount of sugar, because the conversion is actually high, the body tries to keep up. The pancreas produces insulin. You remember when I was talking about it produces and continues to try to keep up with the amount of sugar that you are bringing in. And for lack of a better word, the pancreas at some point, let's say, gets just tired. And that is the time you get type 2 diabetes.
While anyone can develop diabetes, certain factors can increase the risk.
So the risk factors for type 2 diabetes, the diet that we consume. I'll give you an example. When we all finish campus, we are all thin. Then at some point we get married, or you are married, or something happens, you have children, and all of a sudden, a guy who had a BMI that was low starts to increase their weight. Now, what is weight? Weight, which is a risk factor to diabetes, is actually stored sugar. And now the pancreas is taxed with producing insulin. So inactivity is another risk factor. Just we are driving everywhere, we are using the elevator, so we become very, very inactive. And then a last bit of risk factors which is usually there are two things. One, the genetic factor, where we say maybe your mother, your uncle, your auntie had diabetes, and you therefore can have a small predisposition to type 2 diabetes. Type 2 diabetes is also associated with lifestyles like smoking and taking too much alcohol.
How long you've had diabetes plays a big role, all right? So for someone who has had diabetes for 1 year, compared to someone who has had diabetes for 10 years and 15 years, the risks will be different. But sometimes at the point of diagnosis, we are not sure how long your blood sugars have been high. So that's why we emphasize that the first time you're diagnosed, have your eyes checked. How well controlled your sugars are is another risk factor. If your sugars are well controlled, your risk is very low. But if your sugars are high every time, they are 15, they are 20, they are 18, then your risk goes even higher. Patients who have both diabetes and hypertension, the risk goes high, and also those who have high cholesterol, the risk goes higher.
The most common symptoms of type 1 diabetes include frequent urination, extreme thirst, increased hunger, unexplained weight loss, fatigue, and blurred vision. Type 2 diabetes shares similar symptoms, but they usually develop more slowly and may go unnoticed for longer.
You can actually be living with diabetes and you don't know. What are some of the things that make you realize that I need to go and now be checked? Number one is weight. Check your weight and especially convert it with your height, something we call BMI. If your BMI, you are in the ranges of overweight going to obesity, then it's always good for you to check into a healthcare center and check your sugars. Number two, so you just feel tired. You wonder what's wrong. I haven't done a lot of things. I'm just feeling off. I think these are the number one symptoms that I see the most with type 2 diabetes. So that by the time now you're presenting with the real symptoms, probably diabetes has already been there for even 1 year, 2 years, and you had not been checked. Now the real symptoms are the ones now the sugar has now gone too high, and again now you start presenting like the ones that I described, where you are peeing a lot, you're drinking a lot of water, and you are actually eating a lot of sugary foods.
Just like type 2 diabetes, diabetic retinopathy often does not show any symptoms in the early stages.
When it's starting, usually doesn't have any symptoms. Then with time, the leaking and the bleeding in the eye progresses. It progresses and then it starts leaking to the jelly of the eye, what we refer to in scientific terms as the vitreous jelly in the eye. So at that point in time, now you may start seeing what we call floaters. That's it, like shapes that seem to be floating in your vision. You try to swat them away, but you can't quite get them out of your vision. Then as the disease advances, then it starts affecting how clearly you can see, what we refer to as the visual acuity. So to make it more practical, you're watching TV, you realize you can't read the captions so well. You're walking on the road or you're driving, you can't read the billboard so well. You're reading your book and you're noticing the vision is blurry. When you go to the hospital to have your eyes checked when you have diabetes retinopathy, we start off by first checking your vision, what we refer to as visual acuity, how clearly can you see. So we have these special charts in the clinics that you read, and it is able to classify for us your degree of vision. After that, depending on which center you go to, we check the back of your eye, the retina, either using a camera that takes a picture, or we can physically examine the eye. If we are going to physically examine the eye, there are special eye drops that we use to to put in the eye to help open up the eye properly for us to see the back in detail. So now once we have put the drops and the eye has dilated properly, then we examine using a special machine and lens that now we examine the back of the eye. We watch out for the bleeding that we have mentioned. We look out for any swelling of the blood vessels and any swelling of the nerves at the back of the eye.
Now let's take a closer look at glaucoma.
My name is Dr. Angie Komode. I'm an ophthalmologist by profession. Glaucoma is a disease that affects the nerve of the eye. So it's a nerve disease. So it's an optic neuropathy. The eyeball, if you think of it like a tire or a football, it also has its own eye pressure. So the normal eye pressure is between 10 to 21. Beyond that, the nerve is very sensitive. And the nerve itself is made up of millions of cells, and they start to die slowly over time, a very painless process. And so we tend to call glaucoma a silent thief of sight, because the nerve cells that have died, we cannot recover them, right? So it's irreversible, but it is progressive.
There are several risk factors that can increase the likelihood of developing glaucoma.
One of the risk factors for getting glaucoma is age. The older we grow, the higher the likelihood of getting this condition. Another risk factor is family history. Big studies have shown that if you have an immediate family member, that's your parents, your sibling who have glaucoma, the likelihood of you having glaucoma as well is about 30%. High eye pressure. The higher the eye pressure, the more likely you are to get nerve damage. But you can have things like injury. Injury can also trigger glaucoma. You've damaged the drainage system of the eye mechanically. Other things like uveitis are conditions in the eye, inflammation in the eye that will cause the blockage of the drainage system of the eye.
Because symptoms often appear late in glaucoma, regular eye checkups are crucial, especially for those at higher risk.
In the early and moderate stages, very asymptomatic, so we're not waiting for the symptoms. Most of the time, we lose peripheral vision first.
Peripheral vision is what one sees out of the corners of the eyes without turning their head. It helps one stay aware of their surroundings, detect movement, and navigate safely without always having to look directly at everything.
We adapt and we adjust, so we start turning our head completely because our peripheral vision is gone. But because we're adapting, we don't notice. So as you're driving your car, maybe this I've had as a complaint in some of my patients, they didn't see another car coming or see someone crossing the road or see something happening, and they were very surprised and it's already in front of them. Yeah. So it's a very common complaint that we lose our peripheral vision first, and then the central vision is what is left. When it is quite advanced is when we start to notice, hey, I can't see clearly. And by that time, usually we've lost one eye and one eye is left. I had a patient who was under the age of 40 and she was expecting. And one eye was completely blind and the other eye. During the pregnancy, there was acceleration. I think the eye pressure went even higher, and therefore the vision loss really advanced very quickly. And she noticed, hey, I can't even see in this one eye, and this one is also not the best. So when she covered the eye, one eye is completely gone. And when she came to the hospital, it's true. One eye was completely damaged. So really, it was a rush to try and save the only remaining eye.
Coming up after the break.
So we talked a bit about diet,
Yes.
but now I want you to just explain a bit more. For instance, with the Kenyan diet,
Yes.
what are some of the foods that maybe we don't even realize
Yeah.
that they have sugar and they have sugar,
Yeah.
and we
This
don't
is-
think they're healthy?
Yeah, this is a very important question, and which I find our population really struggling with.
So if you have diabetes, your diet is very, very paramount, because what you eat actually has a lot of weight on how well your sugars are controlled.
This is an image that I used to try and explain about the drainage system inside the eye.
Diabetes doesn't change how you live. It can change how you see the world, literally. From damaging the tiny blood vessels in the eye to increasing the risk of glaucoma, the threat to vision is real, but it's often silent. When we come back, we dive deeper into the discussion as we explore the solutions and preventative measures. Stay with us. And now for a short healthcare tip. If you have diabetes, make it a priority to get a comprehensive dilated eye exam at least once a year. Diabetic retinopathy often develops without any noticeable symptoms in the early stages, which means you could be losing your vision without even realizing it. During a dilated eye exam, your eye care professional can detect subtle changes in the retina before they become serious. Along with keeping your blood sugar, blood pressure, and cholesterol under check, these regular eye checkups are one of the most effective ways to protect your sight and catch any problems early.
We are living in a lost and broken world, constantly bombarded by messages of hate and atrocities. But with God, we can overcome. Find hope and restoration on the go through life-changing shows on the Family Media app.
And then you will lose yourself and gain the world. And Jesus said, what good is it?
Get to stream Family TV and Family Radio 316 straight from your phone. Catch up on a show you missed or create video streaming playlists by saving and watching videos from our huge variety of shows at your own convenience. Download the Family Media app, available for all Android and iOS users on the Google Play Store and Apple Store respectively. Family Media, keeping Jesus on the airwaves.
Welcome back. Before the break, we uncovered how diabetes silently damages the eyes, leading to serious conditions like diabetic retinopathy and glaucoma, both of which can cause irreversible blindness if left unchecked. But the question remains, can anything be done? The answer is yes. There are treatments, interventions, and preventative measures that can save sight and change lives. Let us speak to the doctors one-on-one as we continue the discussion.
So this is an image that I used to try and explain about the drainage system inside the eye. All right. So if you think about it as a cross-section of the eye, if I cut the eyeball cross-sectionally, this is what is inside the eye. Okay. So this is the front part of the eye. It's clear to allow light to go through. There's a lens in there. So this is a lens supposed to be clear. Once it starts becoming cloudy, that's when we start calling it a cataract. So light goes through to the back. This is called the retina. These are other layers of the eye. And this is our nerve here at the back. These are blood vessels that come in from the brain and into the eye to feed the parts of the eye, right? So if there's pressure build-up inside the eye, the normal eye pressure 10 to 21, okay? If there's high eye pressure inside the eye, the most sensitive part of the eye is the nerve. The nerve starts to get damaged. It's very sensitive to high eye pressure. So where is this fluid coming from? This fluid produced at part called the ciliary processes. The fluid has to keep being produced for the eye to survive. We can't close or stop that production of fluid, otherwise the eye will die. But if the drainage system is not functioning properly, then you have build-up of that fluid.
So this is the optic nerve that gets damaged.
Optic nerve, very good. It gets damaged. So you can see it's made up of millions of cells, about 1.2 billion cells in here. Yeah.
Okay. So tell me something. In the rural areas, is there good access to eye care?
Oh my goodness. Even going to the rural areas, even in Nairobi itself, I think one barrier is just knowledge. Because as you said, one of the questions that I get when I get into contact with patients is what's the difference between an ophthalmologist and an optometrist, right? And so that knowledge gap is part of the barrier. That we also, our health-seeking habits are not the best. I'll go when I have symptoms. I'll go when there's pain or bleeding. If I'm okay, why am I looking for trouble? That we are fighting, and I'm actually seeing quite a bit of improvement because patients say, okay, I've always gotten glasses, I just decided to come for a checkup. Kudos to all those who do, and I hope that more of us are encouraged to do so as well. To not come when there's a problem. Sometimes there are problems we can't reverse or can't fix.
So we talked a bit about diet,
Yes.
but now I want you to just explain a bit more. For instance, with the Kenyan diet,
Yes.
what are some of the foods that maybe we don't even realize that they have sugar and they have sugar?
Yeah.
And we don't think they're healthy.
Yeah, this is a very important question, and which I find our population really struggling with. Now, food can be classified into three major components, what we call macronutrients. But I will add one. So for the sake of this discussion, let's keep it 4. There is what we call vegetables, okay? There is what we call carbohydrates. There is what we call proteins, and there is what we call fats. Now, these foods are very common. You will find any food you find, whether in Kenya, whether you're in any part of the world, we can put food in any of these categories. So we need to ask ourselves, when we consume food, what is the end result? For example, if you consume proteins, what do they become in your body? And proteins become amino acids. That means they're not mainly converted to sugar. They're converted to amino acids, which give you energy in their own basic need. Then we have the carbohydrates. This constitutes a lot in our diet, which I will touch a little bit just now. Then we have the fats. Not very many people understand that fruits are carbohydrates. So all forms of fruits are carbohydrates. Now, I'm not saying that we cannot, because I need to keep saying this. I'm not saying that you can't consume fruits, but I just need to let people know that fruits belong to a group of macronutrients called carbohydrates. All forms of starch, whether you are talking about white, brown, yellow, or pink, whether you are talking about brown ugali, brown chapati, whether you are talking about ndoma, whether you are talking about sweet potatoes, cassava, wimbi, sorghum, all these are starches. Then the vegetables. So with these 4 categories, which one of which is converted mainly to sugar? And these are the carbohydrates. A majority of legumes are actually starch. So you find something like a red kidney bean has almost 60 to 70% starch in it. It's sugar. And only maybe 10 to 20% of it is protein. It's all forms of sugars. Whether you're talking about honey, you find somebody has substituted sugar from the sugar and now they're taking honey. Or they have substituted the honey and they are taking maybe sugarcane. And now they have moved sugarcane to something else. So all these constitute carbohydrates. And this is where carbohydrates becomes an issue, because remember, if you are diabetic, you're not able to process what? Sugar. Because your insulin level is low. So these are the foods now you need to start cutting down.
Both diabetes and diabetic retinopathy are managed using a range of approaches that vary based on the condition's severity.
So type 1 diabetes, we have to administer insulin to the individual or to the patient. For type 2 diabetes, now we have what we call oral hypoglycemic agents, or oral drugs that you can take before we go to insulin. But a bigger chunk is lifestyle change. This can be accompanied by things like technology, where now we even for type 1 diabetes, we also have automated insulin pumps.
In the early stages of diabetic retinopathy, when we examine your eye, what we see at the back is the swelling of the blood vessels. At that point in time, we don't institute any treatment. But what that tells us is that you are at a higher risk of developing even more complications of diabetes in the eye if nothing is done. But we now emphasize that you control your blood sugar better, because with better blood sugar control, now you slow down these complications from setting in. Then we need to follow you up closely to keep monitoring your eye. Then if your disease is more advanced, where now the blood vessels have started bleeding even more, and they have started forming new blood vessels, what we refer to as neovascularization in the eye, at that point in time now we intervene with specific treatment. Most of the time we do what we call laser treatment. Sometimes the nerves at the back of the eye swell when the vessels are leaky, and with that now we need to inject medication inside the eye to clear that swelling. Unfortunately, for some patients, now they come even at an even more advanced stage, where now the jelly in the eye has actual blood in it and there's scar tissue forming in the eye. So at that point in time, the patient would need surgery, where now the surgeon goes into the eye and now cuts away all that scar tissue. And sometimes they combine it also with laser to treat the back of the eye to stop any further bleeding or any formation of new blood vessels, which are not good for your eyes.
How are these vision problems corrected, treated, and even prevented?
The first line is usually eye drops. So the eyeball protects itself really. So there's a barrier so that medications that we take orally or injected, they struggle very hard to get into the eye. So in fact, eye drops work much better and have fewer side effects than medications that we take orally. But we also have for emergency conditions, there are patients who come with in an extreme pain with very high eye pressures. So if I'm saying the normal is between 10 to 21, I've seen patients with pressures of up to 80. So you can imagine such an eyeball, such a small eyeball with such high eye pressures. Patients are usually in a lot of pain, so those we give injected medications or oral medications to take, but for a short period of time. Number 2 is laser. There are laser options. These ones are best for patients who come in the early to moderate stages, okay? Or patients who have high eye pressures but don't have evidence of nerve damage, meaning we caught it before it started. And it works quite well, particularly in our setting, because then they don't need to put medications for about 3 to 5 years after that, but we still have to keep monitoring. Then we have patients who need surgical intervention, meaning we need to create an extra drainage for the eye. When I encounter patients who have one blind eye and advanced glaucoma in the remaining eye, usually I will encourage those patients, you need to have surgery done, because surgery works quite well. Success rate of up to 80%. Yeah. And also in our setting, the glaucoma medications can be a bit pricey, so quite a number of my patients are not able to afford. Surgical intervention actually works quite well in our population.
Preventing diabetic retinopathy is possible, and while not every case can be completely avoided, the risk of developing it and its progression can be significantly reduced with the right measures.
Physical activity. Physical activity is another big aspect where we say you have to put in at least 30 minutes, 5 days a week.
We emphasize on a balanced diet. If you're diabetic, then you need to reduce the amount of carbohydrates that you take. And then more importantly, always follow up with your diabetic doctor, diabetologist, or your physician, because the key, I keep emphasizing, the key is good blood sugar control.
The other thing that people also don't see as a preventive measure is proper mental health. Mental health, as I said, is important. Sleep. So if you don't sleep, your body is in a state of emergency. And this state of emergency produces extra hormones, right, that can stimulate you to eat more or remain in a state of anxiety.
What can the government do to improve eye care in our country?
The Division of Ophthalmic Services actually does quite a bit, and it's very supportive actually to the ophthalmologists and the eye care workers in the country, in not only glaucoma but also in other eye health issues. Yes. So yes, I do think we get good support, not the best of funding. Yes, so every year we celebrate that, and we'll now celebrate to create awareness. That's a week for us to create awareness.
Your eyesight is priceless, and as we've seen today, diabetes isn't just a disease of blood sugar. It is a condition that can quietly rob you of your vision through diabetic retinopathy and glaucoma. But the message is clear. Blindness from these conditions is not inevitable. With early detection, regular eye checkups, proper diabetes management, and timely treatment, thousands of Kenyans can protect their sight and their future. So if you or someone you love is living with diabetes, don't wait. Book that eye exam. Take charge of your health, because when it comes to your eyes, early action truly saves sight. Thank you for joining us. Until next time, stay healthy, stay informed, and take care of your eyes.